Hello and welcome to our ORM IVF webinar. This is our first section, the introduction, and I am Roxanne Buckmaster, nursing manager at ORM. I've been with this company for the past 15 years, and this is my colleague Megan.
Hi everybody, my name is Megan Crowe. I am one of the nurse coordinators that works with ORM. Been with the company for 7.5 years and we're very excited to have you guys joining us today. And what I'd like to do is turn the camera off so you guys can focus on the slides.
So as we start this introduction, we just want to highlight our website, and hopefully you've all gone there at some point. That talks about all of our locations. When you need to contact your care team, we have a couple different ways for you to do that. Your eIVF patient portal, what you created, that you'll receive all of your results. You can also message your care team, our financial coordinators, most of all the departments, you can send a correspondence. These are not for urgent communication because they may take several days to get an answer and they're not regularly checked on the weekend. To reach someone at any time for an urgent matter or just for a question, you can call in and hopefully you know all of our hours. But what you might not know is we also have an emergency service. So if you do have an emergency after hours and you need to reach a provider that's on call, just call the main number and our answering service can help to get you connected to a provider. For cost information, hopefully you've received that through your eIVF portal, but really know that our financial coordinating team is available to you either by correspondence through eIVF, by a call during our regular hours, or you can even schedule an appointment in person. Hopefully you've met or have an awareness of your clinical care team. And your clinical care team consists of your IVF coordinator. And this is your coordinator is who helps you to know what the timeline of treatment is, ensures that all the pre-cycle testing is completed. They're really your main contact and liaison to the physician during your care and your time here at ORM. We also have a clinical support team, which are the individuals who answer the phone when you call in, and they can answer many, many questions that you may have. However, they can also get you connected to your IVF coordinator if there is a specific question in which you have to talk to that coordinator for. When you come into the clinic, you will also see probably the same medical assistant each time. And this is the person who assists during the ultrasounds and many of the procedures that you will have. And this is our ORM physician team. And then these are our nurse clinicians. So your physician, that's who you made your first appointment with and who you've talked to regarding your treatment plan and who is really the one that is overseeing everything. They create the protocol for treatment for this IVF cycle. They are who you will talk to during this journey and who you will see most of the time when you come into the clinic. When it comes time for an egg retrieval, know that the retrievals are done by the physician of the day, meaning all of the doctors rotate in the operating room, and so there's no way to guarantee that your physician will be doing that procedure. All of our physicians are equally capable of that retrieval, and they are all amazing at it. So you'll hear later in the slides, later in the webinars about how the date is determined for your egg retrieval, but you will know 2 days in advance who is going to be doing this procedure for you. If you are having an embryo transfer, the embryo transfers are likely going to be done by your physician. However, there are also times in which you might see one of our other physicians for that procedure. Could be if it falls on a weekend, their vacation, an unforeseen event. And again, all of our physicians are great at this procedure, but we just want you to have this knowledge prior to going through any of this treatment. Our nurse clinicians work as a team with our physicians, and they will perform some of your ultrasounds, evaluations, procedures such as a sun histogram, and also do many inseminations. They don't do the surgical procedures, but they do most of all of the other appointments. They support our physicians, and they also do some rotations on the weekend call and also the after hours call. At ORM, we know that this journey is stressful and we really have your overall well-being in mind. So we have a fertility wellness program here in which we have fertility counselors and also an integrative medicine specialist that are available for you to make appointments with. Fertility counselors are amazing. There's a team of 3 to do individual and also couples counseling. And this just really helps as you're going through the process that we know is very stressful. Also, we have Dr. Scarlatta, who is a reproductive endocrinologist, but he now focuses just on integrative medicine. This is the field in which all those supplements that are available, all of those things that it's really hard to know, should you be taking, should you not, what will enhance your care, he would be the one to talk to, and you can make an individual appointment with him. He also does some seminars in which you can find through our website. Genetics. This has been just a field that has grown by leaps and bounds in the past, maybe 5-6 years. And we have a genomics team here to help you in making the right choices for you and your family building. There are genetic evaluations that are available for you and also for embryo testing if you're creating embryos. And so it's likely that you will be talking with one of our genomics team, either by phone or in person, to just review your options and make sure you're well educated before you engage in any of the future testing and treatment. So that concludes introduction.
Thanks for joining, and please stay tuned.